I don't think it's a myth at all. I think it is a real risk, and in some parts of the world it's becoming a reality for some certain patients. There are strains of resistant of bacteria that are becoming more resistant to antibiotics emerging in some parts of the world, the Indian subcontinent, some parts of southern Europe, that are proving very, very difficult to treat. You probably have heard in the news last week in the States there was a case of an E. coli which was completely resistant to all known antibiotics that we have available to treat the patient. So this is going from myth into a reality, although it may not be an immediate reality for us here in Gibraltar. It's something that we certainly have to be aware of.
Okay, so it is a big problem. What are the scientific and the medical communities doing about it?
First thing is to safeguard the antibiotics that we have at the minute and make sure that we use them judiciously when they're clinically indicated and for the right indications, and trying to use the antibiotics that are targeted to the infections that we want to treat. So for that we may develop antibiotic guidelines which may help us choose the right antibiotics. So say for instance here within the GHA we have developed some new antibiotic guidelines this past year for the treatment of adult patients in hospital, and pediatric guidelines will follow, and we're trying to make them available in as many formats as possible. So we've developed them on an app that has been purchased so that every doctor will be able to carry them on their smartphone and access them whenever they want 24/7 to make sure that they choose the right antibiotics for their patients. So that's one way. The other way is obviously as a medical and scientific community we need to look at ways of developing new antibiotics, novel agents that will be able to circumvent some of the resistance mechanisms that we're encountering from certain bacteria. And also perhaps not as applicable within Gibraltar as such, but certainly we are susceptible to it, is looking at use of antimicrobials and antibiotics in agriculture and in farming as well, because that is thought to, there's lots of antibiotic use in agriculture which could then enter and influence the bacteria that enter our food chain.
Now that you mentioned that, I remember reading recently that in some countries cattle are sometimes given feed that is laced with antibiotics because that helps them to grow quicker and larger. It's surely rather ironic that whereas people are sometimes denied treatment with antibiotics, in some places cattle are getting them quite easily.
Yes, exactly. It is something which certainly in the UK the government are looking at quite closely, and within Europe there's lots of concern about trying to control the use of antibiotics in cattle farming, in chicken farming, in fish farming. It's all, obviously farmers want to keep their crops healthy and maximise their yield, but at the same time there is a public health consequence.
If we look at the problem from the other standpoint, the patient who goes to a doctor thinking that he or she might benefit from antibiotics but doesn't get them prescribed because the doctor thinks that there's this eventual danger of them becoming ineffective. Surely that patient ought to be receiving the treatment that they need and have the antibiotics prescribed.
It's a question which is posed often, and we're trying to sort of tackle that with all clinicians, be it hospital or primary care clinicians. There is when in the consultation, the physician who assesses you, be it a primary care physician or a hospital physician, will use all the tools at their disposal to try and work out if infection is bacterial or viral. Bear in mind that antibiotics only work against bacterial infections, and in some cases it is a difficult distinction to make, and you may find that general practitioners may err on the side of caution and may choose to prescribe an antibiotic, or they may issue a delayed prescription to say, well, if you don't get better then pick up your antibiotics, or they may not give an antibiotic at all. There's medicine relies a lot on the clinical assessment of the individual, but I think it's fair to say that within my specialty, within microbiology, the tests that in the near future will be available to us as doctors to try and help guide decisions will get better and quicker. We're not there at the minute, but I think within the next sort of 10 years or so, probably the way that we diagnose infections at the bedside will change quite significantly to allow us to be more precise.
Lovely.